Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we've got a great lower body and hip realignment twisting maneuver that's going to help reduce many problems from the feet, the knees, all the way through the hip, help realign you, keep you out of a lot of those postural and mechanical disturbances that are causing your pain. Hope you enjoy. So rotational distortions in our lower body and hips are many times the reason why we have recurrent ankle, knee, hip problems. Anything from lateral tracking kneecaps to anterior hip malpositions, hip flexor, TFL, ITB problems, chronic pronation, plantar fasciitis, many times are related to the same kinetic chain dysfunction that exists in so many people. So many of us have a tendency to turn our leg outwards. We stand, we sit with our legs crossed, and over time, one leg more than another starts to externally rotate. The actual thigh bone starts to turn out, the soft tissues that hold it there become tight, and we have difficulty keeping it straight. As we walk, as we run, as we squat, lunge, work out on our elliptical Stairmasters, that leg is slightly turning out, and it's causing a number of issues. It's causing the foot, when it strikes, to pronate or lean in on its inner edge. It's causing the knee as a joint to move in valgus or bow-legged. It's causing the kneecap to track laterally. And it's causing a pinching of the hip joint as that bone moves forward and turns out. Also many times causing an uneven pelvis, which can affect lower back function and a mechanical stress all the way up. So this is a nice, easy, corrective twisting maneuver you can do at any time. You're just going to have to identify which leg turns out. Again, if you're not sure about your own body mechanics, I invite you to go to either the Posturesize or the Pain Free and Fit website. We have a free body analysis there where you can learn, test to examine and analyze your own body mechanics and posture and figure out what your unique issues are. Because remember, any type of healing or therapeutic exercise needs to be specific and tailored for your unique body. Otherwise, generic exercises many times only strengthen our dysfunctions, leading to more pain. That's the problem with a lot of PT programs out there, rehabilitation programs that aren't working. You're not doing a specific exercise program for your unique body mechanics. So, to correct this, let's say my left leg is the one that externally rotates. I'm going to simply stand with my feet parallel, and I'm going to use my hips to twist my pubic bone into that side that usually turns out. And if you notice what that does, if you relax your leg, it allows the inner edge of that foot to come up. That's countering the normal tendency for it to pronate. It's actually causing supination of my subtalar joint, which is above my heel or connects to my ankle. That's helping to stretch in a corrective way that area. If you also notice, it's taking the knee joint that usually from this distortion bows in, and it moves it out, allowing the kneecap to slide back in, helping to correct lateral tracking patella problems. It's also taking my hip, I'll show you from a slightly different direction, and as I turn my hip, it's moving that whole pelvis backwards. It's assisting that hip to move back in the socket. And if you're doing this correctly, you'll feel your lower back as you turn. That pelvis on that side will actually depress or move downwards and backwards, helping to take the torque and the hip hiking tendency out of our pelvis, affecting the lower back. So you can do this anywhere from 10 reps up to 30 or 50 reps. From the beginning, I'd suggest you only start with about 10 reps at a time, maybe 2 or 3 times a day. Remember, you're not trying to feel a big stretch with this, just a little motion. We hold the end range before we come back for about 2 seconds. And we're just cycling back and forth, mobilizing and slowly undoing all that fascial tension that exists. After you get done, you're going to notice you're going to be able to perform your workout. You're going to be able to walk with that leg a lot straighter, better knee mechanics, hip mechanics. Very simple maneuver with a lot of therapeutic benefit. Hey, if you'd like to help me share this vital information with others, give me a thumbs up below. If you want more videos on hip realignment, knee and ankle healing exercises, please feel free to subscribe to our channel. We've got lots of great exercises for you. We've got great books on this, e-programs, all available on the Pain Free and Fit and Posturesize websites. Use this in your warm-ups. Use this before you go for your walks. Use this before you're going to be doing anything such as walking, stair climbing, using your lower body, squats and lunges, especially after you've been sitting for a while or your body's been dormant, not moving. This is a great way to warm those areas up. Many times people with knee pains, hip pains, after they sit for a while, they do this 10 to 20 reps after you get up. You'll find your mobility is much improved. Hope you enjoy this one. Use it to your health to stay pain-free and fit.